Good morning. My name is Patty Scholting. I am Director of Curriculum Assessment with the Physician Assistant Program in Omaha, Nebraska. And I'm here today to give you an overview of our program with some information in regards to precepting our students in the clinical phase. I've included some learning objectives, which you can read at your own leisure. The PA program basically started to take steps in developing, the Omaha program was developed in approximately 2016. We started taking steps to develop the program. And in 2019, we actually matriculated our first class and graduated our first 24 graduates in December of 2021 with a Master of Physician Assistants Studies degree. We are now admitting our fifth cohort for the class of 2026, and we've had really outstanding students. Briefly, I want to talk about the program curriculum and just briefly talk about the didactic curriculum so you have an idea of where our students start and how they get from point A to point B. Our didactic curriculum is approximately 28 months. We begin in August and they also then end in August in their didactic phase. It's 12 months total. During this time, they have early clinical integration and they also have interprofessional experiences. They're able to go out and shadow and also participate in some clinical activities from day one when they start their didactic phase. Our clinical phase then follows the 12-month didactic phase, and it is 16 months in duration. We have a broad network of opportunities in the Omaha as well as other states. Here's just a sample of our curriculum. As you can see, we have 3 semesters in the didactic phase, the fall semester, and sorry, it's 2021. It's a little old, but still the same. It's 18 weeks in duration, and it's a combination of interprofessional activities as well as what we call Foundations for Clinical Medicine, which is our foundational course, which then our clinical medicine courses then build upon that. We start off with clinical medicine course in orthopedics and rheumatology, followed by HENT and dermatology. Then we also have clinical practice skills and PA profession and the health system course. The spring semester is a majority of our clinical medicine courses, as well as a clinical practice skills course. And then our summer is a combination of clinical medicine courses, as well as a research course, another systems-based course, and clinical practice skills. We also have a course called Preparation for Clinical Practice. It's a very short course, approximately 3 to 4 weeks in duration. We do some of our summative didactic testing in that area, as well as prepare our students for the clinical phase. This is the clinical phase curriculum. We have our core required rotations, and we also have something called selective supervised clinical practice rotations, which are basically required. They're just a little different. And then we have a wide variety of elective rotations, which we continue to add to pretty much on an annual basis. We've just added 2 more courses here recently. Throughout the clinical phase, the students also participate in something called the seminar series. Each semester of the clinical phase is a new seminar series. Seminar series is a place we do some testing and assessment in. We also have professionalism activities and also advanced instruction on clinical medicine topics at a higher level. This is all done asynchronous. So the students, no matter where they're at in their rotations, they can do it asynchronous and it works very well. The didactic curriculum is basically an integration of curriculum. It includes our clinical medicine as well as integrated with our basic sciences. It's delivered in a very modular approach to integrate the student basic sciences, such as anatomy, physiology, pharmacology, microbiology, immunology, as they're related to specific organ systems. This also includes activities in the simulation center here on campus in the new Werner building, as well as a lot of clinical skills hands-on type activities. Here's a visual of our didactic curriculum. As you can see, we have integration of our basic sciences within our clinical medicine courses. And then below is a list of courses. There's four courses that basically run the entire semester. So practice skills, health systems, ethics, research, those types of courses basically run throughout the didactic phase. But our clinical medicine courses are anywhere from about 4 to 8, 9 weeks in duration, depending on the topic and the organ system. Moving on to the clinical phase, which is 16 months in duration. There are required rotations, like I said. Family medicine is an 8-week rotation. Internal medicine is ambulatory as well as hospital. So it's 4 weeks of ambulatory internal medicine and then 4 weeks of hospital medicine. Our pediatrics, women's health are both 4-week rotations. Behavioral health is an 8-week rotation with a combination of inpatient and outpatient experiences. Emergency medicine is a 4-week rotation, and surgery is an 8-week rotation, with the first 4 weeks being general surgery and the second 4 weeks being in a surgical subspecialty. And that's part of our selective rotation below. We also have a 4-week medically underserved primary care rotation, which basically supports our mission and also the mission of Creighton University. 3 months of elective rotations are done after after the completion of your required rotations. So they do 12 months of required rotations. Then the last 3 months prior to graduation, they're able to do elective rotations. And they're able to pick and choose what they would like to do based on their interest. And like I said before, we have the senior seminar course series, which runs throughout the clinical phase. Here's just a sample of what our individual student schedule would look like. We provide this to the students once their schedule is developed. This is all done in a software platform by the name of eValue, which will also be doing all our assessments and evaluations of the students in that platform as well. Students also log all their patients and all their experiences in the eValue system. This is a little bit more of a visual of our clinical phase and how we're able to distribute our students evenly so that we don't have overlap in regards to our students. And as you can see, there's 2 breaks. I believe that is fall break and probably it looks like, Christmas break and spring break. And then we also have something called a summative block, which occurs at the end of the required rotations in 12 months, in which we do all our summative testing prior to graduation in 3 months. Then we have a graduation block, which is basically just getting them all back on campus in preparation for graduation. For the class of 2025, which is currently on campus, they just started in August, and they are in their first semester, or ending their first semester here shortly of their fall semester. They'll begin their clinical rotations in August of 2024, late August 2024. The fall rotation is block 1 and 2 in that previous slide that I showed you. Spring then is block 3 and 4, and summer is block 5 and 6. And then in fall of 2025 is when they'll begin their elective rotations. The students are able to, they have breaks in regards to university holidays, but they're also encouraged to work days like the day after Thanksgiving. Many clinics are open. So it's not a university holiday for our clinical phase students. So if they are in a clinical rotation which works the day after Thanksgiving, then we certainly encourage our student, or actually require a student to work that as well too, unless they request the day off. Their winter break around Christmas is approximately 3 weeks in duration, so they get a nice long break there. We also provide them Good Friday, and then there's a 2-week summer break as well, which occurs in the summertime. And like I said, the late August summative block and the early December graduation block all take place in Omaha. We bring all our students back, whether they're in other states or even in Western Nebraska, which is a good 5-6 hours away as well too. And they all come back to the Omaha campus to complete the summative block and as well as the graduation block. Assessment, students' favorite. And the rotation exams. For each of our core required rotations, all students are required to successfully pass the nationally established PAEA, Physician Assistant Education Association, end of rotation examination in that given specialty. There is not an exam associated with any of our elective rotations. Our grades for our students are then basically acquired by taking the end of rotation exam. If they pass that and they have a passing on their preceptor evaluation for the course, then they receive a passing grade for that rotation. End of rotations occur every 2 months, typically on a Friday. So the students are excused from clinic on Friday in that every 2 months. So they're able to complete their end of rotation examinations, which they will do on campus. Student expectations. Students are expected to work in the clinic at least 40 hours, and so they have good clinical exposure each week, but not to exceed 60 hours per week. Now, occasionally that may happen, and certainly we understand that, but we try not to make that a habit. So the students maximize their learning opportunities. Students should not be required to perform clerical or administrative work for practice and not be used as a substitute for regular clinical or administrative staff. So this really truly should be a good clinical experience for the student. Preceptors. Um, our Our qualifications for preceptors are pretty basic, to tell you the truth. We require that you have a 1 year minimum experience. So if you've just graduated from PA school and you have 1 year of experience, you're certainly qualified to be a preceptor. Board certification in a physician's area of specialty, NCCP certification for our PA colleagues, and NP board certifications is also required for our NP preceptors, and a valid state license without any conditions attached or qualifications for our preceptors. Now, the responsibilities of preceptor are interesting. Basically, you need to assess each student at the onset of the rotation. Get a good idea of what their knowledge level is, what their skills are, and start to develop an idea how you want this clinical rotation to go. Review expectations with the student. Review that they need to be there at a certain time and they're going to probably be staying until this time until the work is done, and those types of things. Provide ongoing timely feedback. Providing students with feedback is very important. Let them know what they're doing well and let them know what they need to improve. Supervise, demonstrate, and teach, observe clinical activities. Certainly get them involved. This is not a shadowing experience. They need to have hands-on experience with patients. Feel free to delegate increasing level of responsibility as the student becomes more experienced. Certainly there's a different from the first rotation to the sixth rotation in regards to students. So, when you do that review of the student, when you first meet them, get a good idea what experiences they've had before so that you can build upon them. There's many mechanisms that you can precept students by direct observation. You can definitely do some teaching in regards to providing the student with assignments. As a preceptor myself, I've done that in the past where I had topics of discussion each week. I was in internal medicine, so I would do things like congestive heart failure 1 week, which we would meet at the end of the week after I provided them with some reading material and have them do a presentation to me in regards to the disease that I have assigned that week. So that certainly is acceptable. Immediate evaluation and presentation. This is nice. And when they do their oral presentation to you in regards to patient presentation, give them feedback in regards to what's needed, what's not needed, how they can basically shore that up so it becomes a very effective tool. In addition, our preceptors should demonstrate culture of humility. In all interactions with patients, families, and healthcare teams and systems, you're the role model. Make sure that they are learning from you in regards to that aspect as well. You can certainly review and encourage them to document. I think that is not only it's a lighter lift for you. You don't have to document, but let them document in the EMR. It also provides you with an idea of how their clinical reasoning skills are developing. Develop an ethical approach to care of patients. Demonstrating an ethical approach, I think, is very important. We do teach ethics, but I think seeing it in action in true patient care is very valuable. As a preceptor, you'll need to complete and return student evaluation forms to assess performance and improvement. We do this at the midpoint of the rotation. So if it's 4 weeks, in 2 weeks, you will have an evaluation of the student. It's very quick, just some general feedback, and then that is all done electronically. And then please promptly notify the PA program of any circumstances that may interfere with the patient's safety or wellness, or if there's any problems with the student whatsoever. We want to hear about those things. We rarely have that happen, which is great, but occasionally you may come across something that you may want to let us know. And I think that's very acceptable, and we certainly want to hear about it. As a preceptor, you will need to complete evaluations on the student. At the end of the rotation, the preceptor will receive an electronic-based evaluation, which is basically based on the framework of the Entrustable Professional Activities, or EPAs, which I'll go over in my next slide. EPAs basically are tasks that provide a foundation for programs' ongoing formative and summative assessment of learning activities. There are 13 entrustable professional activities, and these are basically tasks that assess competency. And so these are pretty general tasks in regards to clinical medicine: gather history, perform a physical exam, document a clinical experience, enter and discuss oral orders and prescriptions, recommend and interpret common diagnostic studies. This is what your evaluation of the student will be based on. They're done on a Likert scale. They're relatively easy, and they're all done electronic on our eValue system, which you will be provided a link to so that you're able to do it on basically any device, your phone, your laptop, and any location as well. There's also opportunities for feedbacks and comment sections, which we always encourage, and not just negative feedback, but please provide the students with positive feedback too. I think the positive is equally as important as sometimes is the negative feedback or the opportunity for growth. Our EPAs, our 13 EPAs, are then linked to our program outcomes, which in turn provides us the ability to monitor the progress of our students in regards to basically reaching our program's outcomes by the time they graduate. Our program is based on a grading scale of pass-fail, and so are our clinical rotations. Our program outcomes are pretty basic. They include patient care, medical knowledge, practice-based learning and improvement, interprofessional and communicational skills, professionalism, and systems-based practice. That is all I have for you today in regards to our clinical phase, our curriculum, and our preceptors. We truly, at Creighton University, Omaha, would like to thank you for your participation as a preceptor, your interest as a preceptor. We know it takes time. I've been a preceptor myself for many years, and it does take time, but it certainly is a valuable tool. I think the best way to continue learning is by teaching, and teaching students is certainly something that is something you want to pass along to our future providers. So we certainly thank you for your time, your talents, and dedication. If you have any questions or you desire to have more information on how to become a preceptor, please reach out to any of us. The clinical team includes Darwin Brown, myself, and Donna Zarnicki, which is our clinical coordinator. Our phone number for Darwin Brown is right there, and you can certainly call him and he'll pass along any messages.
I do have a couple questions. Oh,
okay.
Yep. There's the CE information, but a couple
Correct.
questions that came through.
Okay.
Does somebody need to be a PA, or can they be an MD, DO, another type of physician to be a preceptor for PA?
All of the above. We accept DO, MD, NPPA, any of the above. We've had some nurse midwives as well as help out in regards to our women's health rotation as well too.
Hey, excellent. And the other question that came through was, you were talking about health systems and ethics training during that didactic time. And is it the same type of gold track curriculum that Creighton medical students receive on a weekly basis, or is it done in a little bit different way?
It's similar but different. Unfortunately,
Okay.
we don't have the luxury of the time that the School of Medicine has in regards to our education process. Our didactic phase is only 12 months. So we integrate ethics throughout each body system. And one of our partners, one of our Jesuit partners, will teach ethics for our students and basically provide them with an ethical case, which they'll work through the process of how to evaluate that and reach a decision or reach some sort of resolution to the ethical case. The students find it very valuable. It's very interactive. And it's typically done, I would say maybe 4 to 5 times a semester. Our systems-based course is a course that basically focuses on things like Medicare, Medicaid, third-party insurances, public health, those aspects of health that are important for the student to know as well, too.
Thank you for that. Any other questions for those that are on with us live? If you want to unmute, then you are welcome to do that. But I think that answers all the questions that we got in the chat.
Perfect. Well, I'd like to thank everyone for joining us today. If you have any questions, please don't hesitate to reach out. My number is also available online as well. You are welcome to call me at any time. I'm more than happy to help. So thank you very much.